Hello, this is Dr. Margaret, and this is a training for the contingent levels of reinforcement behavior intervention. Here's what you're going to need when you have to do the contingent levels of reinforcement. You're going to need reinforcers, probably edibles, and you're going to need a timer, a visual timer, probably one of those little kitchen timers. And I also need you to have a token board, just like a little, it has to have 10 tokens on it. So a little 10 token board. Now, these items need to be in full view and throughout your session, but they need to be under your control as a trainer and not the control of your patient. So I'm going to give you a hint when you pick reinforcers. Don't pick a reinforcer that's so strong that it's going to evoke problem behaviors in your patient. So, for example, a lot of our patients really like that iPad, but when we try to take that away from them, it evokes problem behaviors from them. The problem is with this program, you have to have a lot of give and take of that reinforcer. So don't pick something that's going to cause major behavior, other types of behavior problems for you, or evoke problem behaviors. Just choose something a little less than that. You might save that really powerful reinforcer for the end of session terminal reinforcer, or the end of what you're doing terminal reinforcer that they can earn for really cooperating really well. But listen, don't give that to them unless they've actually earned it. Don't give it to them. Don't give that really terminal reinforcer to them unless they've actually performed and, say, for example, earned the color on their smiley face behavioral chart or whatever other earning system, token system that your supervisor has approved. You want to give it to them if they earn it, but you don't want to give it to them if they haven't earned it, because you don't want to inadvertently reinforce wrong responses, right? Okay, so here's something that I want you to know about the contingent levels of reinforcement. The patient does not need to understand the contingent levels of reinforcement in order for them to work. The research is really clear on this. They've used this with a lot of really low-level patients, and it works. It's really just back to ABA principles, selection by consequence, that an organism will select their behavior based on the consequence that they desire, and that they're going to drive towards a greater consequence. And in this program, we definitely use that driving towards a greater consequence because we're using varied levels of reinforcement. So they'll drive towards the biggest reinforcement, the most desirable reinforcement, and it's an automatic thing that they drive towards it, so they don't need to understand it, okay? So here's what you do as a technician. You're going to engage the patient for 10 minutes, or however long your particular target is. The maximum one is 10 minutes, okay? You're going to deliver a verbal praise every 30 seconds that the patient is without problem behaviors. You're not going to deliver verbal praise if there is a problem behavior, okay, in that 30-second time frame. You're going to deliver a token for each minute if there's no problem behavior during that minute. But there's a response cost in this. So that means that if you do have a problem behavior during that minute, you're going to remove a token. That's the response cost. You want to remove it where during the time when the patient can see you removing it, but you're not saying anything, you're just removing it. They'll get it. You want to prime all transitions with like a 1-minute mark and then a 30-second mark. So for example, you might say only 1 minute left, and then at 30 seconds you might say only 30 seconds left. Or if you have a patient that doesn't understand time, you might just say almost done and then count down maybe, or something like that, okay? So prime your transitions for sure. So when you actually give the reinforcer for this is at the point that the timer goes off. Then you're determining what level of reinforcer that patient earned, and you're determining it by looking at the token board to see how many tokens they earned during that chunk of time. So here's the deal. The targets tell you how long you're going to run your time for. So for example, the first target is for 2 minutes. So it's 2 tokens, right? 1 for each minute. So you're going to set the timer for 2 minutes. Each minute they're going to get a token. Every 30 seconds, they're going to get a nice little verbal from you. And then you're going to, when the timer goes off in 2 minutes, and of course, you're going to prime that transition. You only have a little time left. Timer's going to go off pretty soon. When that timer goes off, then you're going to figure out what they earned and what level of reinforcement they're entitled to. That's when you deliver the reinforcer at the end of the target, okay? So I just want to talk to you a little bit about how these targets work. The targets are based on minutes, and they start out really low, okay? So the maximum is 10, right? But we don't start at 10 because some of our kids, we're building the tolerance, right? So we're going to start out really low. At the actual program starts at 2 minutes. Your supervisor may tell you to do something different. Do whatever your supervisor tells you to do, depending on where baseline is. So, but let's talk about the first target that I have set in the program at 2 minutes. You're setting that timer for 2 minutes. Every 30 seconds, you're going to tell that patient, doing a good job, whatever. When you only have 1 minute left, you're going to say 1 minute left. And then at 30 seconds, you're going to say 30 seconds left. Make it more simple if you need to. Timer goes off. Of course, you're giving your kiddo, if you don't have a problem behavior during the first minute, you're giving your kiddo a token. Second minute, I have a problem behavior, I'm taking a token off. Okay? So, when the patient masters out 2 minutes, they're doing 2 minutes on a regular basis for you without problem behavior, then the next target will be 3 minutes. So now we're up in the ante. Now they got to do everything for 3 minutes, and they got to master that out. And then once you have them performing for you on a regular basis at 3 minutes, it goes up to 4 minutes. Now they have to earn 4 tokens, 1 for each minute, 4 minutes. And then before they can reach their reinforcer. So we incrementally increase that so that we build their tolerance. Understand? Okay. So let's go back to the 2 minute thing. We've delivered 2 minutes with our kiddo. It's been the 2 minutes. The first minute, the kiddo did great. They got, here's what our token board looks like. Okay, so you start with the token board. Here we go. This kiddo has to earn, he's on the first target, which is 2 minutes. So this kiddo just has to earn 2 tokens, right? So I've removed 2 tokens from the board because when we fill this board, the kiddo is going to understand that they've earned their great reinforcer because it's a visual, right? So the first minute, 1 minute goes by, kiddo did great, kiddo gets their token. Of course, I delivered every 30 seconds. You're doing great, good job. Okay, we're into the second minute. I didn't have any problem behaviors during the second minute. This kid actually sat for 2 minutes, right, and did my demands. So they get a token for the second minute. Look, you filled the token board. So now I'm going to look at my flow chart. They filled the board. They filled the board. So they're going to get the green, which means they reached the target. This first target right here. See the first target right here? Their first target is what they're on. They had to earn 2 tokens, right? So they did earn their 2 tokens. See, they earned their 2 tokens because they filled the board. There was only 2 missing. They filled the board. They earned their 2 tokens. So you go down on the chart. They did do it. So you go down here where it says full access. They get full access to their reinforcer. Full access, if you read the chart, means that they get a verbal praise. And, you know, listen, they got green, so they get a big verbal praise. High five, buddy. Whoa, you did it all yourself. Good job. Party time, right? It says they get 3 Skittles or whatever it is. I mean, 3 goldfish or 3 M&Ms, whatever it is they're earning. And then they get their preferred activity. They get their escape. Okay, look at this chart. No matter what they do, you see that little timer there? No matter what they do, they get an escape. So we're not holding escape from them. That's what makes this not have extinction in it. We're not blocking them from having extinction. We're not putting them on a scheduled extinction. No matter what they do for us, they're going to get some type of escape. And if you look at the chart, if they got green, they did what they needed to do for the 2 minutes, you're going to set that timer for 5 minutes. They're going to get 5 minutes of escape to their preferred activity. Good? Okay, let's look at something different happened, okay? We're back to our token board. The kiddo has to earn 2 minutes. So I'm taking 2 tokens off because they have to earn 2 minutes. Their target is 2 minutes. They have to earn 2 minutes to fill that board. So I've removed 2 tokens. Are you following me? Okay. Minute number 1. Kiddo does really good. They get their token for minute number 1. Just put it on there. Don't say anything. Don't say you earned a token. Just put it on there. Minute number 2, got a problem behavior. So he did not earn his token. So what do we see here and what does the kiddo see? They see a token board that is not full. So they did not earn, on our chart, they did not earn the green, right? They did not do the response requirement. But you know what? They're still going to get something. They're going to get level. They're going to get yellow. I mean, not level, yellow. They're going to get yellow because yellow is for the response is partially correct. So they earned something. They didn't earn the 2 tokens they were supposed to earn, but they earned something. So they get yellow, which is the partial response. So follow the flow chart. What does it say for yellow? It says that they get, instead of getting their full access, they get a sample. What does it say they get when they get sample? They get 1 Skittle, or whatever, M&M, whatever. 1 Skittle, only 1 this time, not 3, only 1. They get a verbal praise, but hey, it's not party time because they didn't do green, right? So it's just like, okay, good job. Just give them a good job, something calm. It's not excited. Your voice isn't elevated. It's a lower level of reinforcement. They get less edible. They get a lower level voice out of you, and they also get less escape time. So now you're gonna set that clock for 3 minutes. Now they only get 3 minutes of escape. So that's the contingent level. So they get a bigger level of reinforcer. They get full access to their reinforcer if they do green and do what they're supposed to do. They still get something if they do a partial for you. It's a lower level of reinforcement, okay? And over here, this red, okay. Listen, we got 2 minutes. We got 2 minutes. I'm taking 2 tokens off. This kiddo, listen, problem behavior for 2 minutes. Let's say minute 1 goes by, he earns something. Minute 2 goes by. We got major problem behaviors. I'm removing it for this response cost. We got nothing on this board, right? So, so this kid he failed to respond, red, right? So he got nothing. But listen, so he's not going to get any snacky thing. He's not going to get any kind of comment from you at all. Just refrain from your comment. And look he only gets 1 minute of escape. So set the timer for 1 minute. Here's the thing you need to know. You need to have some powerful reinforcers, right? And you need to have them at the table. When this kid gets yellow or red or even green, when you have to bring them back to the table to come back to work, you need to entice that patient back to the training table with a strong reinforcer. You're not going to sit at a table and say, come on back, or tell the parents to go get them and bring them back. You're going to, like if they're reinforced, they really like Play-Doh as their escape activity, then you're going to be sitting there saying, oh yeah, look, I got the purple. I'm making a snake. This is fun. Entice them back some way, something that will interest them to want to come back to the table. Okay, so you got to entice them. You got to make them want to come back to the table. Does that make sense? All right, I want to add one more thing. This is what I would use. Your supervisor may or may not choose to use these as well. That's up to your supervisor, but I would also use color cue cards. I might use them like a ticket so that the kid gets to know the color. So like this one says full access, and it's pink. So they're always going to know that when they get the pink card, they'll figure out that a pink card has more value, right? And then I have one here that says sample, and they'll figure out that a green card they get a little less. They're gonna want the pink card, right? Because they don't get as much with the green card. So when they earn a green card, I might hand them a green card when I set the timer for them to take their break. And then yellow card, only 1 minute away. It's a not yet. So I would use these as little cues for that patient to understand. like tickets that I give them when they earn their escape. I'd give it, okay, go ahead, you get 3 minutes and give them this card. They're gonna, you earned a green card, and they'll understand green card's not worth as much as like a red card, and a yellow card stinks, right? So they'll get to understand the colors of the cards that they've got, and that they'll want the one with more value. They'll work to earn the red card. You might also use them like if you're setting them on the table for a kid that might really understand, or really aware kid. I might set them on the table and just kind of slide out, okay, so that they get the idea, okay, we're starting out. At this point, you've earned full. I'd always start out with the positive. I put full out in front of them, but if I have to take a token away, I might slide the pink card out and slide in the next color card so that the kid gets the message, oops, you're going down. It's like a second visual in addition to the token board. If you want to use these, I use these, but every supervisor might feel like, different supervisors might feel like they don't want to use it. Check with your supervisor, okay? So that's basically the contingent levels of reinforcement. So this is instruction, training, and I would ask you to, and a modeling for you. I would ask you to practice a few times, maybe with some coworkers, maybe at home with your family. Practice delivering it. It actually really works. There's a lot of research behind this. It helps you to not use extinction. It keeps you safe on sites where behaviors cannot use extinction because we can't risk an escalation. So get really good at it, because you'll find that I use the contingent levels of reinforcement quite often. And you're doing a good job. Keep it going.